We're live. Good. We're going to get started in just a minute. I'm actually pulling up the live. Of course, I don't see it live on my phone yet, but we're waiting to see. Folks, thanks for joining us. This is County Executive Mark Molinaro. We're going to get started. With our live telephone town hall in just a minute. I know right now we're calling thousands of folks across Dutchess, and many of you, I should say, are watching on Facebook. And give me a minute. I'm actually going to bring up the page so that I can follow along as well. We'll get started in just 1 second. Well, good evening, everyone. I'm Mark Molinaro. I think you know that. I'm the county executive here in Dutchess, and we're calling thousands of Dutchess County residents. We'll be joined by quite a number of residents tonight as we give you an update as to coronavirus, COVID-19, here in Dutchess County. So as we're calling and you're getting on that line, if you have a question, if you're on the phone and you have a question, dial 0 on your phone and you'll be sent to a queue where we'll give you an opportunity to record a question. If you're watching on Facebook and you'd like to offer a question, you can type it in the comments. We're going to open with some basic data and some information before we get to comments. So what I'd like to do is get you updated as to the current status here in Dutchess. As I do that, again, this is Mark Molinaro, County Executive. For those of you watching live, I'm going to repeat that often so the folks on the telephone call know who they're talking with. But we are joined this evening by Dutchess County's Commissioner of the Department of Behavioral and Community Health, Dr. Anil Waidyan. Dr. Waidyan is an infectious disease doctor. Also joining us is the Commissioner of the Department of Emergency Response, Dana Smith, along with Deputy Commissioner for Special Needs, Tony Sharfella, who works obviously and sort of manages our Think Differently initiative, and she'll be given an opportunity to share some thoughts with us a little bit later. Also is Dr. Ellen Marks. Dr. Ellen Marks works for the Department of Behavioral and Community Health. She is the lead of our trauma team, chief psychologist, and she's going to join us a little bit later to talk a little bit about not only the services available to those who might be dealing with mental wellness concerns, but also some of the steps that we can all take to weather what is an anxious and difficult time. We also have tonight with us Karen O'Brien Edwards. Karen is the Director of Community Services for Greystone Programs. Karen is going to talk, as we mentioned, a little bit about ways that we can work together to support those with intellectual and developmental disabilities. So again, this is County Executive Mark Molinaro. We are in day 23 since the first case of COVID-19 here in Dutchess County. As you know, coronavirus, COVID-19, is spread across the country, and without question, as Governor Cuomo has said many times, and we agree, New York State and New York City is and are the epicenter of this pandemic. This is an enemy, if you will, unlike any other, and as a community, we are working hard to respond. So, as you likely know, over the course of the last several weeks, we have seen more and more cases throughout Dutchess. As of today, and these are cases that are confirmed by our own Department of Behavioral and Community Health. Let's start with, since instituting mobile testing, Dutchess County has initiated in partnership with Nuvance, Pulse MD, and Mid-Hudson Regional, over 2,900 tests across the county. I want to remind you that we're calling individuals across Dutchess, so as you're getting onto the line, you're on a live call with County Executive Mark Molinaro. I just want to give you a brief update as to the status of cases and our response to COVID-19 here in Dutchess. We're going to be on the phone for a solid hour, so we'll have opportunity to take your questions in just a few minutes. So again, we have administered over 2,900 tests. Now, of course, this is not a test. Not everyone who has contracted COVID will have received a test, but those that meet the protocols established by our partners, the New York State Department of Health, CDC, and others, 2,900 cases. We have 592 confirmed cases, individuals with who have contracted COVID-19. And since the onset of both the testing and our response, 37 individuals have been identified as recovered. And of course, that number is greater for those who maybe never tested positive, never presented themselves in any way, but certainly there are those, and we know there are those who have contracted COVID and have recovered either at home or under some medical care. But since the onset of testing, 2,900 tests administered, 592 confirmed cases, 37 recovered. I want you to know that sadly we have had to report 5 deaths related to COVID-19 up until today, and sadly today we saw 4 more lives cut short because of COVID-19. So 9 confirmed deaths here in Dutchess County. I want you to know that just as we've talked all along, as this pandemic continues throughout our community, we are going to see more cases, as you know, and we are going to see, sadly, more deaths. I want to talk to you a little bit about some of the information that the governor's reported on, and I think it'd be useful as sort of an explanation as to where we are. But I know that you all join me in extending our thoughts and prayers to the family and friends of those 9 individuals who have lost their lives here in Dutchess County. Today there are 66 individuals who have contracted COVID-19 in area hospitals, and we'll talk a little bit about our planning both for hospitalization and what we expect will be a surge in demand for hospital care. So let's talk a little bit about what we know. COVID-19 is, of course, a virus. We know basically how it's spread, although not entirely. But we do know this. We are prepared for and have been responding to both community transmission, meaning individuals who can transmit it person to person, within families, within our own communities, and then what you would consider a sort of travel transmission, meaning somebody comes from another location where there are a high density of cases, and they can transmit the disease. As you know, this country early on, in order to flatten the curve, and we'll talk a little bit about that, actually prohibited travel between America and other countries that had a high number of COVID-19 cases. Well, as we recognize New York as a state, New York City in particular has been identified as the epicenter, we have to be very cognizant that we're an interconnected community and that there are individuals who may travel to and from other locations like New York City, Westchester, and others that need to take into account that the ability to transmit the disease is much more likely and certainly easier that it would occur. So we have a few slides that we're going to walk through, and I think you basically understand this. This particular slide, for those of you who aren't watching, speaks to this concept of flattening the curve. We know that we are several weeks behind Westchester and New York City in total COVID-19 cases. So as testing started only a week ago in Dutchess County, we are able to identify more and more individuals who have contracted COVID-19. You are going to see those numbers continue to rise. And it is likely that they are going to continue to rise for another 3 weeks. Knowing what the governor and others have said about when we reach that apex, the peak, if you will, of that incline, we know that New York City could very well be 2 weeks away, 3 weeks away. We are 2 weeks, 3 weeks, 4 weeks away from reaching that peak. So what do we do to flatten the curve, to keep that slope from being too steep and from infecting too many people? Well, we do the things that we've said we ought to do, and that is banning large gatherings. We of course did that early on. We closed schools to keep and slow the transmission. As you know, the state is limiting travel and asking folks to stay at home and to physically distance from one another. At the end of the day, that is the message. Stay home. Stay home and weather this crisis as best we can. And slow the transmission from person to person. And in doing that, we will flatten that curve. So the ideal, right, through limiting social interaction, limiting that transmission, is to slow the rate of growth so that the peak is much lower than had we not taken those steps, and advance that apex quicker. So the more we do to stay home and to slow that transmission, the quicker we will reach the apex, and the fewer lives that will be impacted, and thankfully save lives. So the message that we have overall is to stay the course, stay home, and to limit your travel as best you can. I would offer you that there is really no reason today, unless you are an essential worker, emergency responder, healthcare provider, to travel into New York City. and we strongly discourage that from occurring. And for those who might be traveling outside of New York City to a home that they may have here, we're asking that if you do travel in, that you just quarantine yourselves for 14 days. We know that that will help to slow the transmission. Out of the greatness of respect, we want people to stay at home, wherever that home is, and to try to limit personal interaction. We also know that we need to take personal action as well through personal hygiene. As we make these calls, you're on the line with County Executive Mark Molinaro. We're going through a little bit of our status as to where we are in Dutchess County. If you have a question on the phone, if you're on the phone and have a question, hit 0 on your phone and we'll take a question. But before we're going to go to Dom in a minute to talk a little bit about positive tests. But before we do that, remember there are steps that we can take. Physical distancing from one another. This is not the time to have a dinner for 50 people at your house or a party in the backyard. And it is sadly not a time to hang out at the park. We've closed playgrounds, we've limited access because we need to slow that transmission. Personal hygiene, washing your hands. Remember, this is useful. The hand sanitizer is useful, but one of the most effective ways to stay healthy is to simply wash your hands. Traditional soap and water, it is in fact the interaction, the friction that helps to control the spread of the disease. Don't touch your eyes and ears because we know that or eyes and mouth. We know that will cause certainly the potential for being infected. Also, if you are sick or you feel like you're sick, it is best to stay home. And unless you have symptoms that are escalating, certainly you want to call your physician first. If it's an emergency, you want to dial or text 911 here in Dutchess County. But those are the steps that we ought to be taking to limit the transmission. So we're going to go to Dom, who has a question regarding tracking positives. Dom, are you on the line?
Yeah.
Go right ahead. What's your question?
Is the health department actively tracing those who are found to have positive tests?
Yes.
Absolutely.
Hey, Dr. Wythian, I know you're on the call. The short answer is yes. When you test positive, we have to go through a tracking effort. Anil, do you want to talk a little bit about what the Public Health Department has been doing to monitor those who test positive? And it'd be a good opportunity to remind folks that these particular individuals within public health are doing an extraordinary amount of work and have been now for over a month.
Thank you, Mark. The answer is yes. Testing, when it's done, we become aware of testing at different stages. Sometimes we get direct results of tests, but in this instance, we usually get testing results. Hello?
You're there. Keep going.
Okay. We usually get test results through the state electronic laboratory system, and oftentimes, depending on the lab, there could be a lag of several days. So when we become aware of a positive result, we reach out to that individual. We make sure that individual is on home mandatory isolation, and then we do a contact tracing of all the individuals who may have been in contact with that case, and we make sure that those individuals remain on home precautionary isolation, watching for the development of symptoms. And so, yes, we do follow positive test results.
Thank you, Anil. If you have a question, press 0 on your phone. We had a question on Facebook from Christine regarding why it takes 5 to 7 days to get test results. We have seen, sadly, as long as 10 days to get test results. Anil, do you want to talk a little bit about the overwhelming burden that's been placed on laboratories?
Yes, thank you, Mark. There is a tremendous burden, and there are backlogs depending on the laboratory that it's sent to. And so part of that explanation could be just it takes, in terms of the equipment that they have, there may be batching tests, and it may take a long time for them to get it onto the system. Another explanation is also the lack of supplies and reagents. And so depending on the lab, sometimes the lag time can be several days. And as Mark mentioned, Sometimes, unfortunately, it's been more than a week.
Sure. And I know that the governor and others have been trying to both accelerate the rapid tests, right? Those are not rolled out entirely across the country, and the FDA and the State Department of Health haven't clearly articulated, right, those final regulations as it relates to these rapid tests. But that's something that could be coming our way in the near term. And of course, the state has been working hard to expand laboratory capacity. So that is hopefully something that will relieve some of the pressure. It's either Caroline or Carolina on Facebook asked a question regarding should everyone be wearing masks at this rate? And this is probably a good point. I'm going to a lot of questions regarding whether or not to wear masks. And I know, Anil, I'm going to ask you to give a little bit of guidance. I'm going to give you a lead in, but before I do that, this is a good time to remind people that, in particular, we know that this disease affects everybody differently, and we know that there are certain higher risk populations than others. We are aware of that. But that doesn't mean because you don't exhibit some other underlying medical condition or that you're young, that somehow you're immune from it. And what we want to remind people, in particular young people, is that one, you can carry it, right? You can be a carrier of the illness. And for those of you who might be going home to an older parent or to a family member who maybe is a smoker or has asthma or other respiratory problems, you can very easily transmit this disease. We know it transmits that easily. So we are saying in particular to everyone stay home, but I really need to impress upon those who I know feel invulnerable, right? Younger people in particular, and I guess I was once a younger person. We need you to honor those and respect those expectations. This is not the time to go hang out playing basketball or congregating in large parties, because it is easy to transmit this disease and take it to somebody who won't be able to weather that particular storm. Now, as it relates to personal protective equipment, I think there's and I saw Dr. Fauci speak about this yesterday. While the FDA hasn't sort of given guidance, or the CDC hasn't given guidance about medical masks, it does make sense, and Anil, you can kind of correct me or guide us a little bit, but it does make sense to keep your face covered. In particular, if only to protect from you transmitting the disease, and we do encourage people to do that. It may be simply use a scarf or a bandana or a traditional medical mask, not necessarily an N95, because those should be fitted and appropriate. But we do think it makes sense to at least cover your mouth as appropriate, especially if you're going to be out among other people. You've got to go to the grocery store, that sort of thing. Anil, do you want to add to that?
The guidance with regard to wearing masks are sort of tiered. Obviously, when it's healthcare providers or healthcare workers who are doing activities that put them at high risk, an N95 would be appropriate. A surgical mask, if you're doing less intense work, may be also appropriate. But again, there's evidence that is coming about, especially that says that with COVID-19, a significant proportion of people may be asymptomatic and be carriers, and they may contribute to transmission. And so, my opinion has somewhat been changed. And I tend to agree that if you're going to go out in public, it may be helpful to wear a mask.
And again, that doesn't have to necessarily be a medical grade mask, although if you have access to those, but we do want medical masks to get to healthcare professionals and responders, but just covering your face or mouth does make sense, at least to slow or attempt to slow the transmission, and we encourage that. If you have a question, hit 0. I want to first take a question from Kathy, and then we're going to go to Glada from Wappingers regarding groceries, and I do want to talk about that. But Kathy on Facebook has a really good question that I know is both confusing to others and causes confusion. Kathy wants to know, why is there such a large discrepancy between the statistics reported on the Dutchess dashboard? If you go to dutchessny.gov, you'll see an impact dashboard. You can actually see the real-time data. But why is there a discrepancy between that number and New York State's number? It's a great question, and there's a very simple, although not the shortest of answers. At about 11 o'clock every day, Governor Cuomo, and we appreciate this, goes to the televisions and explains what the status is here in New York. He gives you a number for Dutchess County and other counties. That number is as of that moment in time. So at 11 a.m. On the day he goes and releases those numbers, that's that day's number. Well, New York State takes those cases in from test sites and what have you all across the state, right? From 11 o'clock until the end of that particular day, county governments are required, like ours, to speak to one of the questions that was already asked. County governments are required to go out and identify, confirm those cases. Some people aren't classified correctly. They may go to an Ulster County test site, but they live in Dutchess, and they accidentally get assigned an Ulster address, or vice versa, and this goes on and on. We have folks that are going to tests all over the state from Dutchess. They could be inadvertently classified someplace else. We also have people who are tested but don't give an address. So the health department throughout any given day identifies those people and tries to validate those numbers. And it isn't until about 9 p.m. on the same day the governor gave you the number that we have refined those numbers and they're more accurate. At the same time, if you go to the dashboard, we're compiling information from hospitalization, 911 calls, etc. Of course, they come in at the end of the day. And at 9 a.m. the next morning, the Department of Behavioral and Community Health, with our staff here, go through all of those data points, they verify all of it, they validate all of it, and they put it online. So the number you see today is actually, right, the validated number as of the end of the day yesterday. And I know that you'd be upset to learn that there's a little bit of a lag, but the whole point of this is that the state gets the data, and then our job is to go out and refine it and validate it. And we don't want to put incorrect information up. So throughout the day we validate it, and then we present it, and it's updated once a day. You'll see that information. And again, dutchessny.gov, very important that you visit that website. So let's go to, we're going to go to Glad. I'm pointing over there because for those of you who watched our live town hall the last time, the person handling the question sat too close to me, so he is now socially distant. But we're going to go to Glada from Wappingers Falls. Go ahead. Did you have a...
Hi.
Yeah, go ahead. What is your question?
Hi, yes, I'm just a little concerned. I haven't left the house. It's hard to get groceries delivered from the shops that do deliver, and I was wondering if the county has any kind of program or will have something where a senior citizen could actually order and have groceries brought to their home if, say, we couldn't get to a ShopRite or a Stop and Shop that does deliver. Because right now I'm really kind of afraid to even go out to a store to pick up anything. So is there any type of program, or
Sure.
Are there volunteers that you know of?
I do, and so I appreciate that question, and I know that you're not alone. There are certainly folks either not sure that they should go out, who have maybe they have some underlying illness and don't want to go out or can't necessarily go out. So we've had several questions about that. Bonnie asked about that on Facebook regarding the fact that if you're immune deficient, what about going to stores? So number one, we want you to visit Dutchess Responds at dutchessny.gov. So Dutchess Responds at dutchessny.gov is our sort of coordinated effort to assist. A couple things. We do have individuals who, first of all, food product is being purchased and delivered to food pantries throughout Dutchess County. Thanks to funding, we secured both donations from residents across the county and other organizations. We've raised a significant amount of money. If you visit Dutchess Responds at dutchessny.gov, we can tell you where those food pantries are, and you can actually access food that way. There are then a group of volunteers who are also available to distribute food from those pantries to locations that may need them, or directly to you if necessary. So, Dutchess Responds at dutchessny.gov. We are partnering with a lot of local communities who are doing this. So we're relying on a whole host of volunteers who are participating. The other thing you can do is call our hotline. Our hotline is 845-486-3555. 845-486-3555. And if you want to access food delivery, right, or service, press 5. 486-3555, press 5 will connect you with those volunteers. This is also a good opportunity to tell you we need more volunteers. Fortunately, Dutchess has really stepped up. There have been a good number of people who have participated and volunteered. If you visit dutchessny.gov, you can volunteer as well. Two kinds of volunteers we're looking for. If you have a medical background or some healthcare background at all, we want you to volunteer for the Medical Reserve Corps. There are a number of reasons that we need your help. One, certainly just to be responsive, perhaps on the hotline, where you might be able to provide some educated response to questions regarding health. But also, we need folks to join our Medical Reserve Corps to volunteer at our alternative care facility. So as hospitalizations grow, and they will grow, we're working with our hospitals now to manage that, and the state of New York is also doing that to manage the spike in hospitalization. But as necessary, we have activated Dutchess Community College as an alternate care facility. That'll be available to us for individuals who shouldn't be in a hospital setting but may not be able to recover on their own, and will need people to volunteer there. So we have Medical Reserve Corps volunteers and non-medical volunteers. You can sign up for either. Happy to put you to work. This is a good opportunity for me to tell you as well that members of the Dutchess County Legislature have also stepped up. They're actually shopping for volunteers, and you can see that on the county website for residents. They're volunteering to shop for residents. So if you go to the county website, dutchessny.gov, visit Dutchess Responds, you'll see all of those opportunities to participate and get the help that you may need. I do want to remind and thank folks who have come forward. We are looking for continued contributions. There are more that we need. We are supplying food products and support to a number of not-for-profits. We're grateful to our partnership with Dutchess Community Action Partnership, Dutchess Outreach, Catholic Charities, the community foundations of the Hudson Valley, all assisting, along with a number of other not-for-profits. I'll get in trouble if I start listing them. And then local organizations, municipalities, supervisors and mayors organizing volunteer efforts within their communities. So Dutchess Responds is the place to go for that. If you have the financial means, we welcome the contribution. We are staring at a substantial need. Because this is going to go on for more weeks, we know more and more people are going to need help, and we need your help. And I know that Dutchess County will step up to do that. So let's do this. We're going to go to Jerry in Hyde Park that has a question regarding personal protective equipment and healthcare workers. Jerry, do you want to jump right in?
Sure. I'm a healthcare worker, and
Thank you.
We were all kind of surprised to realize that right here in Dutchess County, we are suddenly very short of PPE, and 95 masks are being issued, one per healthcare worker. And we put it in paper bags, and we're using them over again, just like in New York City. Is the county doing anything to help us secure N95? This is a crucial piece of equipment.
That's a good question, and the short answer is yes, but on the phone is Commissioner Dana Smith. Dana, do you want to talk a little bit about our operation to procure personal protective equipment? And we've been relatively successful, but admittedly there is a shortage across the country. Both the shortage in supply within healthcare providers, the shortage supply in the country, and a difficulty in moving those products, but we've done a huge amount of work to secure what we can. Dana, do you want to speak to that?
Hello, sir. Thank you. Good evening, everyone. As the county executive mentioned, the answer is yes. Since the onset of this in the beginning of March, we worked with our partners at state and federal government to receive supplies. Unfortunately, the requests of what we're asking for are filled to about a third of what we're asking for. We are distributing that to healthcare facilities, nursing homes, assisted living facilities, and first responders out in the field. Additionally, County Executive Molinaro has authorized me to use every means possible to secure PPE, not only in the United States, but internationally. And over the last 3 weeks, I've become an expert on importing. And we've had some recent success and believe we will have more coming in the very near future. And we continue that effort every day.
I appreciate that, and I do want to say this, and just so you know, we are trying to procure what we can. We are distributing it as effectively as we can. I will tell you the governor's office has been very responsive to our needs. It's just there isn't enough to meet them. And that really is one of the big challenges, and certainly without question, it is the greatest, I think, weakness that we've discovered in this country. since the onset of COVID-19. The lack of these products and the difficult ability to move them. And that certainly is going to be one of those learning lessons, I think, going forward. But we are direct purchasing what we can. We've authorized hundreds of thousands of dollars worth of purchases between us and other counties. We're working with other providers to try to get more access, and we're distributing them not only to the healthcare community, but to emergency responders as well. It's a good time. We had a question from Michael and Eileen regarding hospitals and how are they doing regarding their capacity, etc. So let's talk a little bit about that. First, to tell you that if you see on our dashboard, we're actually monitoring both those who are confirmed cases, those who are recovered or hospitalized. Every day we're going through those numbers with our area hospitals. We speak to them regularly. We're monitoring that. We're also at the same time, they have individually developed their surge capacity, and then collectively, if you've been watching the governor's presentations, the state has sort of created this interrelationship, if you will, between healthcare providers. So let's talk a little bit about that. We expect, of course, that the number of cases and hospitalization is going to grow in and around New York City. It is likely that they are going to push out, which is why facilities have been opened in the city to deal with those cases. If they expand, and there will be certain cases that will exceed the capacity of New York City to provide care, we know this, that certain patients will get to hospitals outside of the city region. In this region, we, through a relationship that Ulster County initiated and the Health Alliance and others, they are opening up a facility, an actual hospital facility in Ulster County, at the Benedictine campus. That will create new beds, COVID-related beds for individuals in the region. And in fact, the strategy or the logistics will be, as cases grow in any local hospital, they'll start to coordinate transferring those patients to that site. That will allow our hospitals to slow the rate of growth. And then from the county's perspective, what we're doing at SUNY Dutchess Community College is converting the dorms into an alternate care facility. These will be for COVID patients, but individuals who wouldn't necessarily, should not be in a hospital setting, but rather would need some assistance, but not traditional hospital care, and that will allow for a little bit of the pressure to be relieved. That's what we're doing. We're doing a daily, regular count analysis, going through over and over again what we know is going to be necessary. And again, we are 2 to 3 weeks before we see the apex, that peak that we referred to. So you're going to see more and more cases. Test results are now coming in, as we said, 7 to 10 days after the tests are being initiated. So you're going to see the numbers continue to rise. Sadly, we will start seeing more deaths. The fact of the matter is that this is a horrible disease for those who are at higher risk, and we are going to see more deaths. I think this is, and there will be certainly more demand, and you're going to see that happen. So we need to continue to hunker down, stay home, do the things that we've talked about, personal hygiene, and also social and physical distancing. This is not the time to throw a party at your house. It just isn't. We need you to respect those rules that have been put in place. I know that we have several supervisors and mayors on the call. We talk to them regularly. We're trying to encourage residents to not congregate at parks. That's why you've seen the playgrounds shut down. And frankly, if there are particular concerns or needs, you should reach out to us at dutchessny.gov or call our helpline hotline at 845-486-3555. What I'd like to do now is talk a little bit about the challenges that everybody has at home, but we know that the burden and the challenge for those living with intellectual and developmental disabilities is great. Today happens to be International Autism Awareness Day. I think many of you know that in Dutchess we've been a leader in responding to and supporting those with developmental disabilities through Think Differently. On the phone with us today is Karen O'Brien Edwards. She's actually going to appear over my shoulder in a moment, along with Tony Sharafella, who is the Deputy Commissioner of Special Needs. And as we pull Karen up, Karen, do you want to talk a little bit about some of the challenges families are facing and some of the things that we should be paying attention to?
Hi, Mark. Thanks so much. So of course, through OPWDD, they provide our services for the agencies that we provide. And as you know, day programs have been shut down, so adults living with developmental disabilities are either at home with their families or they're home in their residential placements. Schools are closed, so children with developmental disabilities are at home with their families, so that raises some big challenges. That kids are home, our schedules are really disrupted, and many people with intellectual and developmental disabilities, especially folks with autism, really thrive on their structured environments. And as you know, routine is very important for people. So it really makes it a huge challenge for families.
So Karen, let's do this. And maybe I'd like to jump to Tony Sharfella for a moment. We had a question from Roberto. Roberto was asking, you know, what are we doing to help children and adults with disabilities? Tony, do you want to talk a little bit about where folks can find resources and some of the services that are available? And then Karen, why don't you jump in right after Tony?
Okay.
Thank you so much. So the Think Differently website is www.thinkdifferently.net, and on that website you will find contact numbers for Linda Monkman, who's the coordinator for IDD and Children's Services here for the county, and I know she's monitoring her emails and getting back to people really quickly. You'll also find my contact information, and again, email is the best way to go now. Not many of us are in our offices. So if you, and I've been watching the questions that have been popping up here on my screen, and I'm jotting down some people's names and numbers, so you know, those families that have chimed in about having someone who's disabled or is looking for services or struggling with folks, especially at group homes, please feel free to send me an email, and that's a great resource. Also, on the website, on the front page, right underneath the COVID-19 information, we have Keeping Your Families Healthy and Entertaining. And if you click into that wonderful page that we've created, you're going to find some activities, you're going to find some virtual videos, you're going to find some wonderful social stories on hand washing and all types of resources, and we're filling it with new stuff every day. So as people are sending us suggestions and ideas and creative ways to fill the time, you'll see stuff from Karen O'Brien Edwards there as well. You will be able to hopefully find some resources to be of help. But please do not hesitate to reach out to me. Again, my information is available right on the thinkdifferently.net website. There's a little yellow guy sitting there to your right. You press him, and there's my contact information. And Linda Monkman, who's the IDD coordinator for IDD services and children's services here in the county.
Thank you, Tony. So thinkdifferently.net or duchessny.gov. There's additional information there. Karen, do you want to jump in? And then we're going to go to a question from Earl, who had a question specifically about the facilities, homes, residences, etc., for those with special needs. Karen, jump on in.
Sure. So at Greystone, we're continuing our operations as far as our residential homes, our direct support professionals, which, you know, I'd really like to take a second to just, you know, extend our gratitude for the direct support professionals at Greystone and throughout the county and truly nationwide. They're really stepping up and stepping in and doing a wonderful job working with the people that we support, keeping them busy, keeping them engaged, managing their health and well-being, and just really, they're just amazing, and they truly are heroes. So, you know, without them, we couldn't do anything that we do. So at Greystone, we're also operating our home behavior therapy program. So for people who had currently been in that program, our therapists are reaching out to families and working on challenging behaviors that way. If anybody needs assistance in terms of challenging behaviors, we'd be happy to help, you know, virtually over the phone, telehealth. You can check out our website, greystoneprograms.org, and we'd be happy to, you know, set something up. So as far as that goes, we're reaching out to our families that we currently support, looking to see if anybody needs support, what we can do. We dropped off some art supplies to families, trying to help people pass the time, just doing everything that we can do to support our families in the community as well as our residential programs as best as possible.
And it's a good time also, thank you, Karen, to remind folks that, you know, I know the challenge of having kids at home. I will tell you that my wife has been doing some very amazing work. And we've been blessed to have so many of our teachers involved. And we do know this, right? Our teachers are trying to make education work in this new environment, and many special education teachers are providing services. I know in my house, My daughter's teacher in her program at Red Hook Central Schools has provided some opportunities. I want to acknowledge also our libraries. Several libraries have provided access not only to those with special needs or developmental disabilities, but everyone you can find online. I read somewhere recently, it's an amazing thing to find out that you can get any book you ever wanted from a library. That's what they do. But the truth is, they have a number of programs that are available online that you can participate in. I want to give a shout out to Miss Amy at the Red Hook Library, who did a very special program for those with disabilities. But these are all the things that we're seeing happen. If you're aware of an idea that's underway or a project underway where families might be able to benefit, add the link or information to the county's Facebook page, and we'll include it and share it. But thinkdifferently.net. Earl had a question regarding facilities with children with disabilities. Earl, do you want to ask that question? And if you have a question, hit 0 on your phone and we'll get to you. Earl, go ahead.
Yes. Thank you so much for hosting the town hall first. And the second, I have a two-part question. First, I wanted to say to the Anderson Center for Autism, where my son is a residential student, thank you. The team on site has been doing a great job. And I know you talked briefly about DSPs. I just want to put a shout out to them and how we can help them as a community. We're trying individually as a county how we can. But the main question that I had is a lot of these students and children, including mine, are nonverbal.
Yeah.
So I think the program has a great plan in place of what to do. But what if one of our children who's nonverbal ends up in a hospital with a case of COVID-19? How is that going to be handled? Obviously they don't keep masks on. They can't communicate what's going on with them. How would that be handled?
Well, first, I will tell you we're very fortunate in this county. Up until this pandemic, we were training law enforcement, first responders, emergency responders on how to interact with those in particular living on the autism spectrum, but anyone living with a disability. And that training, I know, is going to be put to the test during these weeks. Tony, do you want to talk a little bit about the training that we made available, in particular to the hospitals and healthcare providers, and why? We're just fortunate enough that we initiated this through the Think Differently campaign early enough that much of these tools will now be put into effect and use now. Tony, do you want to answer that?
Yes, thank you. A couple quick things. Many of the agencies are creating areas in their agencies that when folks do become ill, they're going to move them to areas within their agencies to provide that self-protective isolation and/or quarantine. So I know a lot of the agencies, I've been talking to them over the last 3 weeks about their planning. They're actually trying to create, in place places so they can continue to care for their individuals on their campuses or within their program structure. So a big kudos to all of those voluntary agencies, Anderson and Devereaux, and all of them that are working diligently, Abilities First, all of them to do that. Also, Anderson Center for Autism and I have been having a targeted goal for the past couple of years to really reach out, and they've been out to all of the emergency rooms in both at Mid-Hudson Regional and at Vassar, and working their way into Northern Dutchess, doing a lot of training with the emergency room staff, how to help folks when they need assistance, with different types of testing, and how to approach and doing a lot of social stories so that the individuals can be prepared. So we have been doing a lot of outreach and work with the hospitals through the Anderson Center for Autism's Supportive Environment Grant that the county has funded to do.
Thank you for that. Thank you, Tony. Dana, do you want to talk a little bit about the equipment supply or the supplies we've made available to those organizations? We know it's a challenge. Listen, everybody in healthcare, whether it's public health and the folks who are sort of managing the response for government or private and sort of public health care, and our direct support staff are doing just tremendous work. But do you want to mention a little bit about how we're trying to connect with the supplies?
Yes, absolutely, sir. As we discussed, there are multiple people working on this. We have 3 people basically every day, 7 days a week, and we receive product in. It's broken down based on priorities, and we do prioritize all of our facilities and push out the product that we can to them and get as much as the order filled. We have supported a variety of programs, all that were mentioned earlier, besides the hospitals and the first responder community, and we continue to follow up with them and make sure that we have a consistent flow of personal protective equipment for those facilities. It may not meet their ultimate need, but we continue every week and every other week to try to push out more product to them.
I appreciate that. They shared with me a note. I don't see all the comments that are coming out of Facebook, but a lot of you are responding to each other and giving each other some suggestions, which is, it's very cool. So Duchess responds, and you're doing it right now, so I'm glad we gave you this opportunity just to talk with each other. You don't need me talking with you. This is what I do. Karen, do you want to add just any more thoughts? We're going to keep you on the phone, but they're going to make you disappear from over my shoulder. If you'd like to talk just very briefly, any other thoughts about things parents should look for or families can look for some assistance?
I think, reaching out to your, if you're hooked up with supports and services, reaching out to your providers, reaching out to your care managers, reaching out to your teachers, your occupational therapists, your speech therapists. They're all been so great through this whole thing. It's offering suggestions and tips and just, giving families ideas of different things that you can try in the home. Home will never replicate school, and nor should it. It's home. And I just want to remind all the families and the parents that you all are doing an amazing job, and you are enough, and you will be enough, and it's going to be okay. We're going to all get through this, and just, keep on keeping on.
That's thank you. The truth is, you are good enough to be an effective parent, and I think that this is one of those times where we're all being called to do the things that we have the capacity to do. I know that the struggle is real. We get it. There's a huge financial hardship on so many. There are great challenges on our small business community. I'd ask you to support our small businesses that are still open. If you need a can of paint, you're doing a little bit of work in the basement, go to one of your local stores to keep people employed. I know many are either doing curbside or you could pre-order. Certainly restaurants, if you're looking for a meal and you have the funds to do it, you can pre-order, and our businesses are still able to do curbside restaurant pickup or delivery. But we know that the pressure is great. I think at the end of the day, we're going to have to summon a lot of courage and a lot of strength that maybe we didn't know we had. And in some cases, whatever you feel is valid and appropriate, and the challenge is real. So we know that you're going to get stressed out. We get that. And we thought we'd talk a little bit about the mental health services that are available here in the county, and spend some time, at least if we had some questions regarding that. I do want to encourage you, Dutchess County operates our helpline, and if you have a mental health concern, you can call or text us at 845-485-9700. New York State is operating a helpline as well. But why don't we ask to give us a few thoughts about sort of the things we should be bracing for emotionally with Dr. Ellen Marks. Ellen, again, is Chief Psychologist at the Department of Behavioral and Community Health here in Dutchess. And she leads our trauma team. Ellen, do you want to offer some thoughts about what people should be aware of? Ellen, did we lose you? We may have lost Dr. Ellen Marks. Chime in if you cut through. So Dutchess County maintains our helpline. We want to encourage you to take advantage of those services. Again, 24 hours a day, 7 days a week. You can call or text 845-485-9700, 845-485-9700. Along with that, of course, if you have questions specifically related to the coronavirus response or you have needs to be addressed, you can call 845-486-3555, 845-486-3555. If you have a question, hit 0 on your phone or type a comment on Facebook. If you're watching us live, we'd like to get to a few more questions if we can. We have about 10 minutes left. These telephone town halls are being occupied by a lot of organizations across the country. I want you to know... we're going to go to Monica, who may have a question. Monica, if you're on the line, feel free. Go ahead.
This is Monica.
Yeah.
I'm from Beacon, and I just want to let you know that my question's been asked and answered.
Oh, do you have another one?
Thank you very much. It's a great work.
Oh, we appreciate that.
The only comment I have is take this very seriously. I just had a neighbor on Tuesday that passed away from COVID-19. I live in a senior apartment and disabled apartment complex in Beacon.
I'm sorry to hear that, and thank you for sharing that with us. Thank you. Yes, her question was regarding covering your face, and we did cover that a little bit. We encourage people, obviously, to do that as well. So let's go through the statistics or the data again. If you have a question, hit 0 on your phone or type in your comment on Facebook, and we'll get to it. As I mentioned, 2,900 tests have been administered countywide since the onset of our mobile testing a week ago. We have 592 confirmed and verified cases of individuals living testing positive with COVID-19. Of them, as you know, we've said 66 hospitalized in Dutchess County, and sadly 9 have died because of COVID-related challenges or COVID-19. As I mentioned, on the phone with us is Dr. Neil Wythian, who's the Commissioner of the Department of Behavioral and Community Health. No. We have a number of individuals on the line with us. If you have a question, hit 0 on your phone. We'd like to bring you up for a question. So, any additional questions out there you want us to answer? We're happy to get to them. Oh, Ellen Marks is back.
Yeah,
We lost you for a minute. That's okay. Would you?
I know.
Why don't you jump in? I said I said everyone's going to get this information on mental wellness, and you weren't there. It was very troubling.
I'm not technologically savvy. All right, so let me just talk about people. It's very important to deal and take control of your stress, and that people need to do something to get a break from their worries. Things that help people to feel calm, whether it's reading or taking walks or listening to music, dancing, cooking, baking, cleaning. It's very important that we keep to a routine, keep to a regular sleep schedule, practice good nutrition. I also want to suggest that people limit their media exposure so that they're not dwelling on the situation or coming up with worst-case scenarios. And very important, stay connected to other people however you can. Set up a coffee date by Skype or FaceTime. Talk with family and friends by phone, whatever digital methods that you can. And most important, you have to know there's no shame or stigma attached to getting outside support when you need to, like through Dutchess County's helpline, which is 485-9700, and you can talk or text or reach out to mental health providers, but helpline is a great access to that kind of help.
Thank you for sharing that. And you mentioned it, and I know this is actually a good point. Regardless of mental wellness, right? Taking on all the news all day long every day is probably not healthy anyway. Meaning it's just a bombardment of information that may not allow your brain to kind of relax. And we say this also for those with intellectual or developmental disabilities. It's okay to shut it off. And if you can get outside, relax, or do something that does seem routine and normal, that's helpful, isn't it?
Yes, very helpful.
I appreciate you being on the call. If we have a question or two, we'll take them. We're going to do this for about 5 or 6 more minutes. I do want to mention that we have 2 more telephone town halls coming up. So on April 15th, we're going to do a live telephone town hall and Facebook town hall. It's actually going to be in the morning. On April 15th, the Chamber of Commerce here in Dutchess County was actually going to host me to talk about economic development and what have you. We didn't want to cancel that breakfast. So it will be in the morning, but you'll have an opportunity to participate in that as well. That's April the 15th. And it'll be focused a little bit more on small businesses and business support, but it'll be another opportunity on April 15th. And then again on April 29th, we'll do this at this time live in this way. So you'll be able to participate in those. And remember, every Wednesday, you'll see a live town hall here of some kind. So every Wednesday there'll be some live activity through Facebook, and the dates that I gave you, the 15th of April and the 29th of April, we'll have another telephone town hall. That said, we want you to visit duchessny.gov for more information. Duchess Responds is that contact that would be helpful to you if you want to volunteer or if you need help or assistance. Visit duchessny.gov and Duchess Responds. Again, our dashboard is live, updated. This is the validated information as of the close of business yesterday, because as I said earlier, the governor releases numbers in the morning. Our Department of Health spends the entire day verifying and validating that information, and then we present it to you the following day, verified and complete. A lot of questions I know regarding COVID, both testing sites and locations. Listen, we want you to know that the municipal information is online. You can see the number of cases in each municipality, but you should know that number is only a fraction, right? There are hundreds of individuals, hundreds more of individuals who have contracted COVID-19. Some may have recovered. Some are dealing with it, may never present themselves for a test. As far as our testing locations, there are several available to you in Dutchess. Dutchess Stadium hosts a test site with Nuvance. You must call your healthcare provider. They'll provide a prescription. Pulse MD in the town of Poughkeepsie is offering testing. Same process. And Mid-Hudson Regional offering testing at Mid-Hudson Regional Hospital, again, by appointment. You've got to go through that process to get the prescription in order to get the test. Those are the standards that are applied regardless of where we live. For those of us who live in northern Dutchess County, the Ulster County site might be the most local for you, and that was an agreement we made with Ulster County. Southern Dutchess, northern Ulster, to allow for the two counties to have access to testing regardless of where you live. Again, 592 confirmed cases. We know that 66 individuals have been hospitalized due to COVID-19, and sadly, we have had to report 9 deaths. There are more resources online, duchessny.gov, that you should take advantage of, and we thank you for that. With just a few moments left, I do want to say this. We are now 3 weeks into a response, and for so many people like our public health and emergency responders, our healthcare providers, and others on the front line, some of whom may never have thought that they were a frontline emergency responders, the folks at the grocery stores trying to stay open so that we have access to food product, those who are transporting products or people. There are so many new first responders that are out there every single day, really working hard to make sure that we can sustain ourselves over what is enduring an unprecedented time. First, we want to thank them, but I also want to thank all of you. I think early on there were a lot of people who wondered, is this real? The sad truth is, it is. There are hundreds upon thousands of people in this country who have contracted COVID-19 and are struggling really hard. There are folks in our hospitals who are holding on to life. And it affects every family. It does. So we need to take this seriously. We need to socially distance. We need to stay home. We need to ensure that we're engaged in personal hygiene so that we can slow the transmission and ultimately save lives. But I do want to say this, as county executive, I am so proud of the people of Dutchess County. Every day you are finding a new way to be patient and responsible and responsive. You're volunteering, you're donating, and you're making something good out of what is a challenging and anxious and unprecedented time. And for that, I'm grateful to you. I need you, we need you to continue at it. We've got easily another month of having to live through these very sort of stringent restrictions. And if we hold firm, if we summon the courage and the capacity to do this, we will overcome this disease. We'll learn from it, and we will save lives because of it. I have that confidence in you, but I also know that it's going to take a lot of work. So we are all in this together. We're going to work together. We're going to rely on one another. We're going to help one another. And if you need help, you need to visit duchessny.gov. We'll be there to help you. You've been on a call with over 12,000 of your neighbors. Over 700 have watched regularly throughout on Facebook. We need to stick together, and we may not be able to be physically together, but we are emotionally one community. and we'll overcome this together. So ladies and gentlemen, thank you for participating. Feel free to continue to ask your questions. Please reach out to us at dutchessny.gov or 845-486-3555. Be well, be safe, and continue to be kind to one another.